All
guys
right.
want me to share my screen?
Excellent. Okay, thank you. Yes, so welcome. Please introduce yourselves and then proceed.
Yes. So I'm Lucy Hodder, the Director of Health Law and Policy at Franklin Pierce School of Law and the Institute for Health Policy and Practice. And we are helping support the department with sort of outreach to stakeholders around, in particular, the upcoming changes that will happen towards the end of the public health emergency that's been declared by the feds around COVID-19, just to make sure everybody is well prepared. We understand the impact of any changes of that end of the public health emergency on Medicaid populations, and especially some of the most vulnerable populations. I think everybody is really aware of the impacts of COVID and how it's affected different demographics of our state. And so the department really wanted to start early and interact with communities around the upcoming changes and get feedback about, what are the best ways to communicate? How can we make sure we're supporting populations as things change? Things about Medicaid eligibility, because there's been, and we're going to explain it, because there's been sort of a relaxation of the eligibility requirements in Medicaid very early on. The feds basically said, as many of you know, look, we want to make sure people have insurance. We want to make sure people are well covered. So we're going to support populations of people with COVID in a number of different ways. One of which is we're going to give people special coverage if they have coverage of COVID and they're uninsured. We're also going to make sure that people get access to Medicaid and don't have to necessarily do what they always do. So once they're enrolled in Medicaid, they're going to stay on Medicaid for the public health emergency. And so what that has done, as many of you have heard, is that has made Medicaid, we're going to show you, have a lot more people on it than would be otherwise eligible. And so there's in New Hampshire a really 220,000, it's about 23% more than there were in 2019. Many of those folks are people who, if they actually filed redetermination notices and let people know about their income, they might not be eligible anymore. So a lot of those people may be ongoing eligible, but may not be. So we want to make sure that the communication to those folks is really clear. The most important thing is, and Deb Fournier is going to take you through a number of those. Let me just stay at the previous slide for a sec, Deb, is that the most important thing is that many of the people who are on Medicaid but haven't had to tell anybody whether they're still eligible may be eligible in a different category and may still be eligible. So part of the communication now, which we're going to go through with you, is that everybody needs to know, get your information in. And we want to be able to be as supportive as possible with people who are transitioning to other categories of need. So if you look here, standard Medicaid is obviously everybody but Granted Advantage. Granted Advantage numbers have certainly gone up, but as have standard Medicaid. So can I just ask, does anyone have questions about how people are on Medicaid and why we have so many people? Because then we're going to get into some sort of a little bit more in the weeds in messaging. And I'm going to let Deb introduce herself, and also Elisa, I don't know if you wanted to chime in and say hello, the amazing Deputy of Medicaid.
Thank you. Sure, I can real quick before Deb does. Good morning, everybody. I'm Elisa Cohen. I am the Deputy Medicaid Director. I don't really have anything more to add than what Lucy has so greatly laid out. We are concerned about the end of the public health emergency. And it's not just New Hampshire, it's every state across the country is dealing with this. Just to give a little bit more background, as part of the Coronavirus Relief Act that was passed last March, in order for, it allowed states to draw down additional FMAP funding. But a condition of that was, as Lucy said, is that anybody who was enrolled in Medicaid as of March 18, 2020, which was the start of the federal public health emergency, needs to remain opened, except for some very specific circumstances. And so as a result, as Lucy notes, the number has increased significantly now with the end. We don't know the end of the federal public health emergency. We are working towards December 31, 2021 end of the PHE, but that's not clear yet. The federal Secretary of Health and Human Services can renew a public health emergency every 90 days. So it was renewed last in April. So now we're July 19th is the next date. Again, we expect that it's going to go through the 31st, but that's not definitive. And then sort of a wrinkle in this, and we'll talk about it a little bit more, is this is different from the end of the New Hampshire state of emergency that's being lifted on Friday. And so we expect there's going to be some confusion as well among those who are receiving Medicaid. This is not impacted by the lifting of the state public health emergency. It's for the end of the federal public health emergency, which date is TBD. So there's a lot of complexities and nuances and that we want to help stakeholders understand, so that when they're interacting with clients or patients or whomever, they're helping people understand that they're able to explain it, to give them the heads up, to see the types of letters that they're getting, so that you have context when you're talking with your stakeholder groups what it is. And we really appreciate Deb and Lucy's assistance and help to message this and to spread the word. And so with that, I will turn it over to Deb Fournier.
Yeah, and we already have a question.
Yep.
Sure.
Whoever wants to respond is, could you please provide a quick description of the
Yep.
difference between standard and granted?
Yeah, just quickly, standard Medicaid is the eligibility categories that are not the expansion Medicaid. So granted advantage are the folks, the adults who are between 0 and 138% of the federal poverty level, the Medicaid expansion population, that's in granted advantage. And standard Medicaid are all the other eligibility categories, pregnant women, disabled, people with severe mental illness, all of the other ways that you can be eligible for Medicaid. So Deb, I'm going to turn it over to you, and we're just going to go back and forth and highlight sort of a little bit about what's being done and the message that we all need help communicating with people who are currently on Medicaid.
Yeah. So, and one other note about standard Medicaid is moms and kids. These are a lot of moms and kids, mostly kids in standard Medicaid, which is not to discount from the folks, like Lucy said, who are living with disabilities or physical or cognitive, but seniors, people with disabilities, moms and kids are primarily the people that we think about when we think about Medicaid. So right now, within that 220,000 people that we talked about, we think there's about 65,000 folks. I shouldn't say we think. The numbers we have seen estimate there's about 65,000 people who have this protected status where they would normally have been off of coverage by now, but because of the public health emergency at the federal level, they are in protected status. And coming up, there's going to be about 5,000 people every month who are going to be notified that either they have unconfirmed information that they need to have confirmed to continue their eligibility, or they're overdue for just reapplying altogether. And so for those folks, there's nothing that anybody can say or share at this time that ends their eligibility before this December 31st estimated end of the public health emergency date. And so the department really is working hard to reach out to stakeholders and communities and providers to say to people, please have the folks that are on Medicaid that you're working with, please have them submit their information if they're getting notices from the department that say that they're overdue or that there's information missing. The important thing we want folks to remember right in here is, and Lisa will talk about more about the notices themselves in a minute, is they're going to come on pink paper. So if your people get a pink letter, that's the one that you want them to submit their information. It's the most protective thing they can do, is to share their information and keep their information updated. Lucy, do you want me to talk about this? You want to talk about like what the department's been doing
Sure. And it's what's the most important thing to know is that the department is preparing really far in advance in a number of different ways. First is to just look at what people's eligibility categories might be, so they can figure out how to notify them and let them know what else they might be eligible for. They are continuing to process all the applications and redeterminations. So they're really encouraging people to get their paperwork in so they can look at what they're eligible for, get them in prepared to transition to a different category if they need to, or confirm that they will continue to be eligible. They are developing really clear notices, as Deb said, and different colors so that people will notice it, to reach out to these populations and help get support from providers to reach out to these populations as well. They're going to be ready with a number of different communication strategies, which Deb can go into in terms of a website, call center, etc., to support people with questions. And most importantly, make sure that people are getting information in before December, so everybody doesn't end up panicking in December about their eligibility category. Deb, next slide.
My keyboard is a little frustrating today. I apologize that I can't seem to. There.
Right. So there have been some stakeholder meetings, and by stakeholder, we mean groups of providers. And the department's also coordinating closely with other state agencies and other benefit programs. The messages and notices are ready. And so they're going to be going out in June. And now the message is going to include clarifying that the public health emergency, the federal public health emergency, continues despite the state public health emergency ending. And so this month, it's really sort of very important outreach to providers and other groups to let them know what's going on and how we can be helpful. And it's really important to note that this task force is so important to help provide reflections on what populations might actually need some special education or outreach, because I think that is really the hope. And we're working with providers to make sure their translation service is available. And Elisa can tell you a little bit more about making sure we are accommodated and prepared for people with English as a second language and people who may be deaf or hard of hearing and other issues, and make sure we're translating this into populations and in ways that will be meaningful. And again, we have until December, so this is the beginning of the preparation time. Lisa, I don't know if you want to add anything more about notices and what the department's doing to really support populations of need.
Sure, thanks, Lucy. As Lucy mentioned, so on Tuesday, the 15th, is when we're sending out sort of the first group of notices. Deb or Lucy, do you have that chart that we can pull up to share?
We'll get it, so just keep talking
Okay.
and I'll get it.
Yeah, there we go.
Okay.
So there is, this is the first sort of tranche of messaging that's going out to individuals who are opened due to the public health emergency, but they may have failed to complete their redeterminations. So, if there wasn't a public health emergency, the case would have closed. Or in fact, they did start to complete their redetermination, and we have information that looks like they may no longer be eligible for the Medicaid program they are in. And so we need additional information from them, whether it be something that shows that they are still eligible or that in fact they're eligible for a different Medicaid category. We want them to send that information in now so that we can process their redetermination, and then they don't have to worry about their Medicaid coverage for another year. They don't have to worry about getting caught up in what we're referring to sort of at the end of December, if that is indeed when the public health emergency ends, sort of the deluge that's going to hit the department of applications and of information and calls. And, you know, there is a strong possibility that there will be individuals who could possibly have a gap in coverage at that time just because of the volume of documentation and readies and information coming into the department for us to be able to process it timely. So if individuals who are up for redetermination now or who are missing documentation now, if they send it in now, they're protected. And that's really what we're trying to get the message out, is protect yourselves now so you don't have to worry about it. So there are 2 different letters going out next week. They're going to be on hot pink paper so that people pay attention to them. And that, again, is what we want to communicate to those who are working with the populations, to tell your clients, patients, whomever, if you get a pink letter from the department, pay attention to it. They're slightly different, but it's the same message. So one is for those, like I mentioned before, who have not completed their redetermination at all. So this is saying to them, please send in your information for the redetermination, send it in now so we can complete it and move it forward. Then there's a category that's getting a letter that says, okay, we have some information that shows you are potentially ineligible. You will be closed at the end of the public health emergency unless you send us XYZ, this information now. So please send in the documentation we're asking for. Slightly different letters, different categories, but it's the same message. Essentially, send us your information now so that we can process that. So those will start going out, as I said, on the 15th, we'll start processing them. So people will start getting them, 16th, 17th, towards mid to end next week. And then we anticipate about 5,000 a month are going to go out based on when a redetermination date should have been, if that makes sense. So that's a lot of information I just threw at everybody. Are there questions, or does anybody need some clarification before we move on? Okay. If not, we'll keep going.
Which way do you want to go? Do you want to go to the website? Do you want to go back to some of the definitions?
I want to, go on to some of the other communications that are going to be coming out. So that's almost everybody who has a redetermination or missing information is going to get that pink letter. But in addition, there's going to be other letters coming out that will likely overlap with when they get that pink letter, which could cause some confusion. There is a letter that's going to start going out to individuals who are in Granite Advantage. Again, that's the expansion group that we spoke about, who are 65 or over, or who could potentially be in Medicare and Medicaid, to say, we have information that indicates that you may be eligible for a Medicare savings program. So eligible to move out of Medicaid into Medicare. Please send that information in so that we can move you to the appropriate Medicaid or Medicare program now. So that letter will be going out in June, which could overlap. So some people are going to get that pink letter, and some people are going to get, in addition to the pink letter, that Medicare resource letter. Then in July, there is a letter going out to everybody in Medicaid managed care about open enrollment.
Lisa, do you want me to share the chart? Would that be
Yeah,
helpful?
that's what I was
Yeah,
looking for.
okay, I've got that.
And this will help explain it a little bit more.
Yep, let me just manage my.
Sure, and I can just, as we keep talking. So this Medicaid managed care open enrollment letter is their standard open enrollment that goes out to everybody. Open enrollment is in August. But again, it's going to overlap with when the pink letters are going out. And so some people may get both, and to just make the group aware of what's coming, that nobody needs to do anything with the open enrollment letter. It's just a heads up. It doesn't relate to the public health emergency, but there's going to be overlap. And so those are the ones that we anticipate coming out over the summer. Then there's several different types of letters, which I'm not going to get into at the moment because it's just a lot of information and we're still working through those draft letters. But depending on individuals who may be in different Medicaid categories, spend down, meet or mode, things like that, are going to get yet another set of letters asking for information. So everyone's going to get this pink letter, but then presumably most people are going to get more than one letter over the course of the summer, and it's going to cause confusion. And so we just want to help to disseminate the message to get your, essentially help clients get their information in now so that we can help with the redeterminations, that we can move things forward, and just be aware that there is going to be letters coming out and that most likely there is going to be some questions or confusions among the people, the population that you work with, to give you a heads up. And also you'll have my contact information and the department's contact information that you should always feel free to reach out to us. It's going to be an interesting remainder of the year, next year, as both the state of emergencies lifted, the national public health emergencies lifted, there is inevitably going to be confusion. We're here to try to help sort through it.
Mhm. And Elisa, thank you. Incredible amount of work being done. If there are, the hope is to have stakeholder meetings, and again, we use that word very broadly. If there are groups of beneficiaries or providers serving beneficiaries that you think it's important for this message to be communicated to, I think there is the hope that that can happen. So communication is sort of critical, especially for the populations that may not, are the most vulnerable.
Absolutely. Thank you, Lucy. And I will just mention briefly, so thank you for inviting us. It was actually, I think Holly Stevens dropped off. Holly Stevens and Anella from OHE are part of our small stakeholder groups, and they're the ones who suggested, let's talk to you, this bigger group. And we thought that was a great idea. And so it's our hope from talking to stakeholder groups, we reach out to more stakeholder groups, we reach out to more populations. Will be as targeted as necessary or as broad as necessary. We really want to try to get the message out to as many people, both beneficiaries and those who work with beneficiaries, about Medicaid, about the redeterminations.
Mm-hmm.
So with that, I'll turn it back to you, Deb.
So I would say, are there any other questions? Otherwise, we don't want to take up precious time. I know you guys have a lot of important things to discuss. And we are always available if folks want us to come and do a presentation to a smaller group of people or to their own specific constituency, we can do that. So Trini?
And from the group, we usually have a few.
We just threw so much information at everybody into the short
I wonder,
time.
Trini, whether it's worth, and Holly, if you might, I know I see you there, what would be wonderful is if you all can actually get some feedback to us about sort of a plan, going forward of ideas that you might have in terms of communication. I think that would be really helpful.
And so that's a question to the group, and Holly can help.
Yeah, I'm more than happy to act as a liaison between Lucy and Deb and Elisa and this group.
Great.
Thanks, Holly.
And we will, the one last bit of information I'll throw at you, but don't worry, you don't need to really process it too much, is to just let you know the department we're working on a website, on a webpage within our department website on the unwind activities. It'll have samples of all the letters. It'll have, it's distinguishing a distinction between the federal public health emergency and the state of emergency lifting, to try to give some clarity and context there. And that's in development, but once that link is ready, we can pass it on, and you can disseminate that widely.
There's also going to provider materials there so people can download a flyer or something to hang in their office to prompt their clients that might be impacted to think about their READY status. So again, we'll forward the URL when it's live and ready to go.
Wonderful.
My clock says 9:30, so I don't want to crowd your agenda, but we're so grateful to have been here. And we really are looking for suggestions about how best to reach all of the people that need to be reached.
Yes, and there are people who missed today who I'm sure would be interested. So I'm so glad we were able to record this. And again, last chance for any questions from group members. I see there's been a couple in the chat.
And we will make slides available.
Excellent. Well, thank you so much for joining us. You are welcome to stay for the duration of the meeting. And with that, why don't we pause